here. I'm going to call up the panelists or the speakers from early this morning to be part of our panel. Shauna Mann, our regional manager, promoted you right there. For our clinics out west, Shelly Bischoff coming up, and Andrea Morley, who I didn't have a chance to introduce very well. Andrea is the Communications and Wellness Coordinator for NAL Insurance and Healthy Trucker. She is working as a nutritionist and has spent 8 years educating the trucking industry on living a healthier lifestyle both on and off the road. These are your panelists for this afternoon. We aim to talk about health and wellness in the workplace, both psychological and physical. And when we talk about health and safety in the workplace, there's a big focus on a big S in the safety and a very small H in health. So although we say health and safety, we think about the hard hats and the PPE and all that fun stuff that goes along with safety. We're getting better with focusing on health in our organizations. And when we do talk about health, we largely talk about physical health. So we have started talking about mental health, and this is why we wanted to have your panelists up here, because they have a slant on things that add to both elements, both the physical and the psychological health. So just to frame things up, September 28th, 2 weeks ago, the World Health Organization and the International Labor Organization jointly put out a call to reaffirm action from organizations to pay attention to mental health, because again, they talked about the ROI. Any guesses to what mental health costs the world economy in 2022? Shout out a number. Any guesses? 10 billion. Going once? Anybody else? Would it surprise you to know it's $1 trillion? So this is the bottom line, right? So not paying attention to mental health and well-being costs the world economy $1 trillion. That's a lot of money for I don't even know how much it is compared to $1 billion, but it's a lot. So they wanted to reaffirm this because not only does it help economically, but it actually improves culture, which we've been talking about being very, very important. Before we get to the panelists, I just want to give you some quick facts, fun facts about mental health. And these are true and false questions. You don't need to answer them out loud. You can answer them in your head. But I'm going to read out a couple of facts, and I want you to take a guess whether or not these are true or false. All right, so you ready for this? Each week, 100,000 Canadians miss work due to a mental health condition. True or false? It's actually false. So the real number is 500,000. So 500,000 Canadians miss work each week because of mental health condition. How about this? 1 in 10 Canadians suffer from a mental health condition. 1 in 10 is 10%. 1 in 10. True or false? False. It is, anybody? How many? 1 in 5, and that was from CMHA stats, but the more recent stats get it even closer to 1 in 4, so almost 25% of Canadians are suffering from a mental health condition. Do you know what the annual economic cost is for Canada? It's $1 trillion worldwide. Do you know how much it costs Canada? $1 billion going once? $1 billion? It's $51 billion. So, 2 more. Only a third of Canadians who actually have a mental health condition seek help. Is that true or false? Would it surprise you to know that it's true? So just a third of people, if I said a third of people who had cancer seek help, or a third of people who have coronary artery disease, only a third of them seek help. How does that sound to you? Well, it sounds terrible to me. I mean, as a physician, I think it just sounds horrible that people who have or are suffering from mental health conditions, only a third of them are actually seeking help for this. And there's a lot of reasons that we could probably talk about. And then one last fast fact. 50% of people who have a diagnosed medical or mental health condition would keep it to themselves. They wouldn't tell their company, their manager, even if there were performance issues. 50% of people who already have a diagnosis, already know that they have something causing performance issues, only 50% of them won't disclose it. False, yeah. Yeah, well, the real answer is closer to 80%. So it's 78% of people who have a mental health condition will not disclose it to their managers or their workforce because of a perceived bias against them, right? So stigma, loss of jobs, loss of opportunity. So this is what we're dealing with. This is, and why do these numbers really matter? Well, think about your teams, right? So 1 in 5 people have mental health. How many people do you have on your team? If it's 5, one of them might be suffering, and there's an 80% chance if they're suffering that they're not going to tell you about it, even if there's a performance issue. Why is that? It goes to trust, it goes to a lot of other things. So given the stats, given the implications, perhaps I can start with you, Shelly, at the end of the panel. Maybe if I can get you to offer your thoughts on some of this.
Why do I have to go first? I'm just saying. You know, if you read that policy statement that was released by the World Health Organization and the International Labor Organization, it's pretty scary. So I work a lot in a unionized environment, and so it's going to take all parties for international recognition of this problem to be addressed. And in that policy statement, in 2020, only 35% of all countries in the world had any national programming available for mental health promotion or the prevention of illness. And in that same year, all countries in the world spent an average of 2% of their healthcare budgets. The government spent about 2% of their healthcare budgets on mental health. It just seems so skewed. We know it's a problem. JD has just given us some pretty significant stats to quantify, right? I mean, we're not even talking about qualifying. We're talking about quantifying this situation. And I think there's still this misnomer that mental health is an individual issue that needs to be dealt with from an individual sphere of influence. Does that make sense? That if I'm struggling with mental health, nobody wants to walk on eggshells or risk making me feel less than, or maybe offending me, or coming out and saying something that might actually exasperate how I'm feeling. And so we come from an avoidance perspective, right? We're avoiding it, and many of us don't know what to say. We really don't know what to say. I mean, governments have so many issues, but mental health in the workplace should be on their radar. Absolutely it should. All of us that are in the workplace should be on the radar of government when it comes to spending. And so the question is why? Where did it go? Why is it off the grid? It's not even on the radar, right? Promotion and prevention. And that policy statement speaks very clearly to the fact that we not only need to promote mental health, but we need to have prevention strategies. Is it Andrea? Okay, so we need to have those mental health strategies in place to prevent it, that risk of it ever happening. So be proactive. I love looking at value on return rather than, or value on investment rather than return on investment, because I really do think it's not about money. It should never be about money. It should be the quality of life. And that these employees in the workplace have people. They have families and children. They have team members. They have a productivity that they want to contribute to society. So, I mean, from my perspective, I just keep asking the question, like, where did it go? Where is it? It's just not on the radar.
Okay. Hari, you just spoke to anxiety and sort of validated that people are actually coming to you with this thing called anxiety. I mean, any thoughts on these stats and what organizations might want to focus on? We've got a great blueprint. We've got some metrics. Any thoughts on that?
thoughts on what organizations should focus on?
Yeah.
Okay. That's a good question. So I think it's hard for organizations to focus on the mental health itself, because a lot of the times organizations are built to and designed to focus on, you know, their stakeholders, and one of the stakeholder is the employee, right? So I think as an organization, it's understandable why an organization tends to look at, you know, the customers, the shareholders, and then one of them being employees. So when it comes to this focus on mental health, I think the thing about quality of life, I think that has a lot of meaning, but when you bring it into an organization, I'm not sure how that would translate into, you know, like someone, like a leader being able to look at that and say, okay, that does have value in the long run. I think one concrete way to look at it is retention. I think people won't stay in organizations if they're not feeling that culture and quality of life and all of these things. So I think in that way it would impact that bottom line if people aren't staying. And I think it's become a lot more competitive now because a lot of organizations, especially when it was harder to get people, like in terms of hiring people, I think a lot of organizations shifted towards putting these things into place. So I think it ultimately ends up coming from a perspective of how is it going to benefit the organization ultimately, right? And then I think mental health is a big part of that. Yeah.
Okay, thank you. Shauna, I want to bring you into this conversation. You come at it from a couple of different angles. Certainly you're a people manager, you manage a bunch of people, but you also come at it from a wellness coach. So you see people who are telling you about their health and well-being. Thoughts on mental health in the workplace, physical health? How does it all sort of come together from a manager and from a health coach's perspective?
I think from my perspective, there's such a disconnect between the mind and the body, and people don't necessarily realize that they really do work in unison. And it's very easy for someone to come to me and I have a sore back, I have a sore knee. They can feel that. There's also objective measurements that we can take to confirm that you actually have this illness or you have this injury, versus we don't have that with mental health. Like, there's really not that diagnostic screen that we can, you know, really see what's going on. And so I think, again, there's that stigma there and the biases that are associated with that people are afraid. You know, there's that stigma that I might lose my job. And so I think it's just really trying to again, coach people through and recognize it's the mind-body connection, and just really making them feel safe at an organizational level. I can speak specifically to my experience at DriverCheck. So I have never been with an organization who has actually had employees feel as comfortable as they are talking about their mental health. And I really feel, again, it comes from an organizational culture perspective. The owner of our company, Maggie, she is not afraid to be vulnerable in front of everybody within the organization. She has an open door policy for everybody in the organization. And I think that really impacts how mental health specifically is seen at DriverCheck.
You were channeling some Maggie's emotions up here.
Yes, I like to call them Maggie moments. I had a Maggie moment today.
Awesome, thank you for that. Andrea, so you are in the space where you actually advise organizations on wellness programs, on things to do, the practical aspects of this. You do this not only for physical health and well-being, but also for psychological health and well-being. Is it necessary to separate these two? Do we have to disentangle physical well-being from mental well-being? What's your advice? I mean, these are individuals who are looking to get, like, how do we manifest this? How do we make this work? What's your thoughts on that?
That's a good question, because I do find that we will hear companies say, we just implemented a physical wellness, a physical health program, and now we're working on a mental health program. But I don't think that they need to be two separate programs. What I recommend that companies implement and just very slowly over time start to implement is a general wellness program. And then that is going to have a ton of different components in it, where there's going to be things that benefit physical health, there's going to be things that benefit mental health, and then there's going to be a lot of things that benefit both areas, both physical and mental health, because I think as a lot of us have experienced before, is that when you are starting to get healthier physically, you start to get healthier mentally, and vice versa. And I think even some of our presentations today touched a little bit on these areas about how difficult it can be when you're experiencing an injury, even if it is something like a rotator cuff injury, and then how that starts to affect you mentally at work, especially when you're trying to talk to your doctors about it and they're maybe not quite understanding how that's affecting you in your job. And that is obviously going to contribute greatly to your mental health concerns. So I may have gotten off track a little bit there, but I just think it is absolutely crucial to make sure your program is super comprehensive when it comes to mental and physical health, and isn't just focusing on one area and isn't just focusing on one thing, such as weight loss, just wanting to get everybody down to a healthy weight. You should be focusing so much more on all of the habits that build into working towards a healthier weight, which is then going to add in so many habits that assist in aiding your mental health. Things like going for a walk, maybe that's on lunch breaks, and getting out for a walking club at lunch. That's going to have huge impacts as far as physical health and mental health, but then also the weight loss that maybe you are hoping some of your employees will want to take part in.
Cool, thank you. And this may tie into the question from the ground. So maybe I'll just turn it over to the audience. If you do have questions at any time, please put your hand up. We'll get a mic to you. Also the panelists, if you also have questions, feel free to ask each other and ask the audience. We've got a lot of people who have got a lot of experience in this space sitting on the floor as well. So it doesn't have to be questions. If you've got comments that could add to this discussion, please put your hand up. We appreciate the two during Harry's talk, but maybe a question over here. Do you have a mic?
And maybe while we're setting up, if I could just add to your comment.
Yeah.
So,
I kind of did, but you really actually led them with the answer that I was looking for.
Oh, okay, there you go. So, return on investment, so that's one of the things that perhaps might be directed to you, Andrea. People are coming to you and saying, all right, listen, we have to spend a lot of money here. What's in it for us? Like, how do you go about telling them about the ROI? That is a real question.
Yeah, it's difficult because you aren't necessarily going to see the return on that financially, especially not in the beginning, because the ROI versus the VOI, the value on investment is going to come after several more years, as we talked about earlier. It will take longer to see, and then you're going to see kind of the financial return as well as like the non-monetary return, kind of synergistically, but at different times. It's really important to note that the company culture and improving that is more valuable than any price tag we could put on that. And the retention that is going to result from, just as you said about DriverCheck and how so many employees feel so comfortable there, that is invaluable in how much I imagine the employees feel that they actually want to stay there. And as Harry said, his wife's new position, the fact that she actually wants to stay there for the rest of her career, that the amount of money that company is going to save over the next 10, 20 years, whatever's left in her career, is going to be massive, because every time that they would have to rehire for that one position, obviously we know that recruiting and retention costs companies a lot of money. We have to look at it from those perspectives. And I had a conversation this morning with somebody about how do you know that something is working? You, of course, are going to want to kind of survey your employees, get feedback from them, Ask them if they're willing to share results. So it should always be confidential as far as how much weight have you lost in this program. That's confidential, but if they are interested in sharing that information, just as far as, hey, this has worked out great for me, just as far as like surveying them and saying, has this worked for you? Yes, I lost 10 pounds over the last 3 months. It's been great. Getting those little tidbits of feedback where you're able to do so is going to be really, really helpful in surveying if something is working. It's also important to know that if you are putting something out there and offering it up to your employees, and then you're kind of tracking participation and seeing, okay, we have 400 people who are taking part in the EAP program every month, and then we have 80 people that do have the gym membership that we're offering. If you look at all the different things that you're offering, see that people are participating, you're getting good feedback from them, trust that that is going to provide you with that value on investment. And I think you'll see that in your company culture, and you will see those improvements be made.
Go ahead, Shelly.
I just want to add that I'm often concerned when organizations think they know what employees need in terms of mental health. They can be very patriarchal. So they decide. They is somebody, maybe in a department, maybe it's a couple of folks, but they decide what they're going to do to help address mental health in terms of promotion and prevention in the workplace. What I'd like to see organizations do is ask, right? To use that humble inquiry. What is it that's meaningful to you? Because what's meaningful to employees may not be what's meaningful to the HR, health and safety, occupational health folks who are responsible for determining what to put into place. Really, at the end of the day, you need to go out to the folks that need that support to find out what's important to them.
I think that's a really great point.
Yeah. And I think that it also ties into what, at the clinic level, what we're really noticing now is really the impact of COVID just now taking a toll on our staff. And so it's almost like this dichotomy of, from a frontline clinic worker perspective, of camaraderie. They were all required to come into the clinic all throughout the pandemic, but then this isolation because they're coming in with all of these protocols in place where they're like literally social distancing. And I feel like people went from a state of human being to just human doing and really became robotic. And it's now really trying to get them out of that state of doing and back to being, and encouraging that connection through regular one-on-ones, regular leadership team meetings. We've even taken it to the next level where all of our East clinics and our West clinics meet every quarter to just really try to establish connection, because there is a direct link, the health of our relationships really affecting our health, our mental health, and our physical health. So again, just trying to implement some of those strategies for connection within the clinics.
Yeah, and that's a good segue. So I'll launch this question, I'll let this sit. I'll go to the audience, but maybe for all of you to consider, what skill set should people managers be equipped with to deal with some of the things that they will have to deal with people's mental health and well-being? So let that sit, think about that. Just go to the audience. Questions or comments? Yeah. Frank.
Okay, 1, 2, yeah, it's on. Okay, I'm gonna take a page from Steve's book and I'm gonna build a little bit of, I'll start with a comment and build suspense and then ask the question. So the comment is for Shauna and the question is for Andrea. So I obviously enjoy the 4 presentations today, but I wanted to highlight, Shauna, your presentation. I think it highlights the JDA and the pre-employment as both a preventive, a reactive and sometimes, but essentially as a preventive tool. And it highlights the importance of the kind of work that you do, and especially when it's done by someone that cares so deeply. So thank you for that. And speaking of prevention, you probably have telepathic powers. I did hit my knee just last week while pedal biking in the river valley, so that was interesting when you mentioned it this morning. But anyways, so speaking of prevention, and the question for Andrea, the wellness program and movement and exercises and all that, you already mentioned some of the things to measure success, the surveys, tracking participation, etc. But overall, have you seen a reduction in or improvement in some metrics, such as absenteeism, or the kind of musculoskeletal injuries because of long time sitting or back problems, etc.? Have you seen reduction in those metrics?
We do find that it is harder to see those very specific types of metrics without going a little bit more deeply into kind of their medical history. You might not have access to that information depending on the field that you're in. If you're doing work where you are, excuse me, if you are in a field where you are doing evaluations, physical evaluations, you might be able to see that a little bit more, but on, say, office staff, for example, that information isn't going to be as readily available to you. But as far as absenteeism, absolutely, and I think that would be amazing, thank you. I think we even had a comment earlier today where we talked about how absenteeism does absolutely drop when you are seeing mental health being talked about more, physical health being talked about more. We have witnessed that in various programs that we've been able to be a part of and watch. So you will see those metrics improve, but don't necessarily count on it because that is what is going to show you more so the value on investment, because you are able to see those numbers. And again, as we talked about, it is harder to see those specific numbers because we tend to see more of the things like better company culture, better retention, better productivity, all very hard to measure, versus reduced injuries, reduced sick days, a little easier to measure, but not necessarily something that people are actually changing. Because, for example, with mental health, because of the stigma that does exist, a lot of people just power through their mental health concerns, and if they are having a bad anxiety day, they just force themselves to go to work, and maybe they aren't as productive, but at least they were there. They didn't take that sick day or that mental health day, so then nothing's actually really going to change for them once their mental health improves and once they're able to get a better handle on that anxiety, if that makes sense.
We also had a comment though, like you actually measured like hard metrics. You had disability or sick days, maybe.
Well, there's a whole measurement strategy. There's a whole card of things we look at, and they've all been named there, even more.
Yeah.
But yes, in our case, and that came as a surprise because we certainly didn't expect that. Even through COVID, the duration of disability leave of long-term disability leave for mental health diagnosis decreased, which is quite surprising, because one way we distinguished ourselves from the book of business is in so much the number of cases, but the duration of it was off significantly. So now that gap is trying to close, and what's surprising to me is that happened during COVID.
Well, it's excellent that you've got trackable metrics on a number of different fronts that you can, and that might be helpful to some of our participants here or looking for that.
It's not completely finished because we've been working on it. When you start looking at it, it gets very complicated and intricate, and I haven't seen the rest of the work, but that's something that's worth doing. Like even before you get started, what are we going to evaluate ourselves against?
Right.
If you look at a variety of indicators that are available to you, then some of it will help you.
Excellent. Yeah.
So I'm not saying this is significant, what we've seen, but that at least tells us that we're going in the right direction. That's
Sure.
how I like to put it.
Yeah.
Perfect. Okay. Thank you. Any other thoughts or comments from the floor?
I did want to add drug utilization and EFAP stats. So we talk a lot about the decrease in numbers, decrease of the frequency, or the severity, or decrease in the number, duration. But I think, one thing that I feel good about is that the number of folks who are actually accessing medication when they need it is good. So you can look at it from two sides, right? You can say, wow, people are really not well, so they're using a lot of medication. Or you could say, finally, we've reached some sort of ceiling, and employees are reaching out and they're actually utilizing a physician and getting medication and having treatment. And that to me is reassuring. The other thing is that I often advise organizations to measure their quarterly utilization rates with their employee and family assistance carrier programs. And so if you're seeing a 4% across all quarters of a year, there's no value or return, very little. So you want to see high numbers. You want people to feel confident enough to be calling that 1-800 or 1-888 number and accessing help by saying, I need it. So look at stats all around. Look at your retention, look at your turnover, right? Look at your metrics when it comes to cultural index. Think about how teams are functioning, look at output. Don't just look at the traditional statistics that we always think of, right? Because I want you to flip the script again and not think in the negative connotation. I want you to think in the positive connotation. So you could even say that having a heated discussion in a meeting is a very positive connotation, where there are a number of people or two people who are having a disagreement in a really polite way. Because is it okay for us to agree to disagree? Right? You're my team. And if we agree to disagree, is that okay? Can we do that in a respectful way in the workplace? So every time we see that in a team environment, that tells me we've got some health. And the way that I measure that is that there's psychological safety living in the room at that time because they feel safe enough to have a disagreement where they agree to have a different opinion. So think about stats differently, flip it.
Yeah, utilization of medication is a really great example of that. You think you'd want to see it low, but actually, if you see it increase, it might be a really good thing. It means that more than a third of the people might be taking advantage of the services that are out there to actually get help.
Yeah,
great
the pandemic has decimated us. I mean, let's just be honest. It's hard to be honest, but employees are really scared. They're scared to come to this conference. They're scared to get on a plane. They're scared to go to the recital at their kids' school function. And rather than us judge it and determine whether that's something that's right or wrong, there is no right or wrong. We just need to know that the pandemic continues in a mindset form, at the very least. Never mind numbers and different waves. And, you know, by variant vaccines, we just need to know that it's scary. And so anytime that employees are reaching out for help, that's extraordinary. Whatever they can do.
Something maybe a little off topic, but that I would love to add to that is that as we progress through the pandemic or as things improve as far as restrictions, I caution employers to not try to jump back into their version of normal. A lot of companies are saying we're trying to get everyone back in the office because it's just so much more exciting for them. It's great to have everyone there and back in their offices, and we're renovating, so we have more room for them in the office, and we're trying to get people out to events. And while events are great and renovations are great and trying to get back to maybe normal is great in some ways, for employees' mental and physical health, there's a lot of ways where that will not be great. A lot of people in several industries before the pandemic were approaching burnout very, very quickly if they were not already there. And the pandemic was actually a blessing in disguise for them, where they were able to pause, take a step back, focus on their health, focus on physical or mental, whatever was happening, or both, and get that reset that they really needed. And for more people than you might realize, the last few years potentially saved their lives. So as far as your wellness program goes, that's actually something to consider as well, is continuing the hybrid or flexible work models that maybe you implemented during the pandemic.
Right. I perhaps want to come back to what skill set managers should have. So I don't want to put anyone on the spot. So maybe I look.
There's a question there.
Okay. Maybe look for one of you to put your hands up. Before I get to your questions, to frame that up, a number of people managers have come to say, I'm not a psychologist. I don't know how to respond. Like, what do I do? So what are the skill sets that we need to equip our people managers with so that they're not psychologists?
So I think when it comes to skills, maybe it's better to take a step back rather than looking at skills, look at it as like a way of being and reorienting yourself. Because at the end of the day, if you do it as skills, it's going to be something that you take to work and you try to use that skill with like a staff member. But if you look at it as a way of being that is going to be a journey, and so it's not something that you're going to be able to learn like any other skill per se. So for instance, something like being able to really listen. That's something that's taken me years, and I'm still working on it, right? When I'm talking to a client and I have a question, so one of the first thoughts I have before I even ask the question, I say to myself, wait, which is an acronym for why am I talking?
Nice. Very good.
Right? So these are things that has taken me a long time, but I can tell you that it's not something that I just use as a skill at work. I try to have that as a way of being that I bring into my family. And over the years, I've learned when I'm in a place to be able to practice that and when I'm not in a place to practice that. You know, like if my son's getting under my skin and it's very hard to not say something, right? And really be curious about why he's behaving the way he's behaving. And so when it comes to whether we call it skills or way of being, I think one of the important things is really being able to listen and understand and connect with a person's experience. And as part of that journey, I think it requires you to go inward to be able to tune into yourself, listen to yourself, connect with yourself. So that's a big part of the journey. If you're doing that within, it'll be much easier to do that on the outside.
Well put.
Yeah.
Self-awareness,
100% agree.
situational
You
awareness.
stole my answer. Yeah, and so I think our three basic core human needs are to be seen, heard, and feel like we matter. And so I think it begins with empathy and that active listening 100%. And if you're in a position of where you're really wanting to help people on this journey, you have to have gone on the journey yourself, and you have to be at your most authentic self. And so, yeah, 100% agree.
On that note, I want to say, so feeling heard and seen, it's something that, you know, I think a lot of us are starting to recognize the value for it. But when you look at it from like an evolutionary perspective, it makes a lot of sense. You know, as human beings, if we went off into the wilderness by ourselves, we would have been less likely to survive. But if we stayed in tribes, we would have been more likely to survive. And what we've passed on is this need for connection, right? It's something that we're all hardwired for. And so you look at how, you know, civilizations have formed, religions, you know, cultures, and all of this stuff, it's all about being in a tribe. And I think over the last 20, 30 years, that's all changed, you know. So I think that sense of community and feeling close and feeling connected isn't there as much. And with social media, we have the illusion that we're connected, but we're really not connected. And so our attachment needs and our need for connection isn't being really met. So a lot of the times it does come down to either our family or our workplace. And the ideal scenario would be you're feeling connected in your workplace and in your family, right? So when you have that need for connection met, so something like feeling heard, this person really gets me, this person really understands, and I can see that they care and they value me. When people have that experience, they feel connected and they feel safer, and that sense of community and all of that good stuff really, I think, is so important.
And Shelly, I'm going to kind of pick on you for a moment, but I once heard on a
Why, though?
podcast by a psychologist, and so basically it was kind of like breaking down biases, but so one thing that I really teach my people is when they kind of go down that path where they're making judgments or assumptions, what I feel is a really effective tool is I say, what's the most generous assumption you can make about that person in that moment? You know, they're coming to me, this person did this, this, and this, and I'm like, you don't know, like, she could have woke up and her baby could have been up all night, and that might be, that's not who she is. This is just a behavior that's exhibiting. And I feel like that's been a really effective tool that to kind of help my teammates and myself get out of some of these biases.
I think that's brilliant. You know, I think at the end of the day, if I could have leaders just be okay with saying they don't know what to do, if I could just have leaders say they're uncertain or they're not sure or they need help, if I could, you know, have leaders ask more questions than giving more responses. Being more curious to get to know the individual. Remember I mentioned impression management where I go to Sue and I ask about her. She's selectively, consciously giving me the words about herself that she's comfortable providing. That may not be the whole story of who Sue is. So if she's on my team, I need to make the time and take the effort to get to know who she is, to fill in those gaps. And I feel like leaders don't. They take things on face values and they're not surfacing their assumptions, right? And I do, you know, like Harry talked about that reptilian mind, and that when the brain is working in that function, and I hope I'm not surprising anyone, but I find leaders decimated right now. The leadership groups that I'm dealing with, they're not coping well. They come off like they're doing okay, but then when we go into a room, they're not doing okay, and they don't want anyone to know that. And they think they're doing a good job of that, but it's not working. So if you're in that reptilian mode, right, you're functioning at that level, how can you be an effective leader? So it's all about having that self-awareness, and sometimes we have to have courage over comfort. So sometimes we have to help people when we know they're really struggling. We need to offer that help. I always love asking questions or making comments like this. I have noticed, I am wondering, I am here. And I say this over and over and over in my leadership group sessions and my employee group sessions, because I don't want to say you. There's no yous. I want to take the yous out of it, because for leaders to look at skill development right now is really asking, that's a huge ask right now. They're just trying to survive. By the way, the HR side of me is saying, who are we hiring anyways? There's no employees. I don't know about you guys, like out in the West, us, you know, our cowboys, in Alberta, we've got no employees. Every single organization I'm working with says, Shell, we have no people. We don't have anyone. And so I want you to think about being a leader in that situation. And so the more we have empathy, seek to learn and think about what others might be seeing, feeling, or thinking themselves.
Yeah, use the softer skills exactly like that. And if you are in the position where you're unsure of how to be dealing with the topic of mental health when your employees are coming to you, remember that you are not the person that needs to be diagnosing and treating them. Yes. You just need to be like the liaison between their work and then the mental health concern that they are dealing with, and then providing them a resource where they can go and get professional help or treatment.
Yeah, and I think at our level, it's more about, exactly like as a coach, I'm not a therapist, I'm not a medical doctor, I'm not a consultant, I'm a coach. I ask questions and I listen. And I lost my train of thought.
You're allowed, totally.
Oh, it'll come back to me, sorry.
Okay, while we're waiting for that thought to resurface, there was a question on the floor.
Yeah.
Yeah, hi, thanks. Brad Manning, Brawny Construction Health and Safety Manager. I deal with unionized construction industry. So health and wellness planning and strategies work fantastic in the corporate side of the entity, but we have not much control over the unionized part of the business. I appreciate and understand some of the comments about managing your getting back to pre-pandemic status and being cautious to that, but also I'd like to just add some observations that I've had. You know, through this pandemic, we were considered essential workers, and even during that time, we were flying and traveling all over the country to job sites that had to be running. And it was very interesting. I've been on planes where they were, the people on the plane were throwing people off for not wearing masks.
Yeah.
And I traveled on October the 2nd, and not one person had one on, including the staff of the airline. So it's a funny mind shift, but it's you don't quite know how to explain it. But you know, in one instance, everybody seems paranoid and must put a mask on to cover up, and the minute that you're allowed to take it off and roam free, well, even in our conference here, I don't think we see too many people that are donning face coverings during this. So I think there's a real desperate need for all of us to get pre-pandemic as quickly as we can. It's just my observation, and become humans again, like Harriet said too.
Yeah, thank you for those comments, Brad. Any other comments or thoughts? We've got Marina back over there.
You know, I'm just thinking about what Brad had to say. I've never seen hatred like I did over the last 36 months. Hatred. Like, I don't know what I thought about hatred in Canada. I don't know. Maybe I'm naive. I've never seen hostility. I've never seen it. And I had threats against my own safety because people didn't like what I was advising in terms of wearing masks and, you know, complying with standard operating procedures. And, you know, you live in that environment enough, and it does affect you. And what I actually had to come to is just to choose kindness rather than the judgment, because I'm like, Brad, how can it be like this on one hand, and then from October 1st to the 2nd, it's like this complete shift. And what happens is that we're running on panic. And I think it's a really good lesson. Like, first of all, none of us were prepared for the pandemic. Us old nurses, you know, we had training on pandemic planning. And we never thought we'd ever have to use the darn information. Well, we really didn't. And I'm older than dirt. And I was pretty sure, I would bet you a beerski that you weren't going to need it. We weren't prepared. So what the lesson is for me is to know in this event of that horrendous situation, Brad, now we know the lesson is we've got to be prepared, and we have to acknowledge that we're going to see the worst side of humanity all over again if it happens. And to acknowledge that that is the human nature, right, Harry, of how we respond and react. Because, you know, some of those individuals that were spitting at me, like yelling at me so much they were spitting at me, not intentionally, are people who now say, hey, how are you? I just give them the stink eye. I'm like, they don't, is it possible that people aren't aware of the hostility they're manifesting towards others? And can I just talk to you about family breakdown? Like, I had dozens of employees who were ostracized from their actual family members, their children, their grandparents, throwing stuff, Brad. At the very least, Brad, they were throwing stuff, not just people. And so I think it's a reminder that, first of all, we have to be prepared, and we have to know that if something happens again in the future, that we can expect this kind of behavior, because that's what we know people do, right?
So I just want to say that kind of behavior, it kind of speaks to when people are feeling so anxious, right? And I think that anxiety has shifted at different stages of the pandemic, right? Mm-hmm. Initially, of course, the anxiety was around the health and the spread of COVID. But as time went on, I think we were swimming upstream because our need for connection, the importance of that started to really come to the surface. Yeah. Like, I want to be able to see a person, right? I want to be able to talk to a person. The stuff that we're wired for really started to come to the surface, and we can try to kind of shove it down, keep it there, but it starts to build up. And so then that when that emotional experience is building, you know, a sense of sadness and all of the stuff that's building when you're feeling alone, then there's this desperation, right? And so in that emotional experience, as people go further into that reptilian brain, you start to see people, you know, do things like behaviors that you would think like, how could that even happen? And now we're in a stage, I think, where I don't think there is going back. I don't think there's going
Right.
back to pre-pandemic.
Right.
I think there's going to be a transformation for our society,
Mhm.
and it is an existential crisis for all of us where we're left kind of evaluating what's really important for us and how do we take that forward? How do we balance health and wellness, whether it comes to COVID or in our workplace and in our families and so forth, right?
I agree.
I promise we intentionally avoided COVID topics for this conference, but try as we
They didn't
might.
tell us about it. They didn't tell us about it.
Try
Yeah,
as we
nobody
might,
mentioned
we
it.
cannot ignore it. It surfaces itself. I'll go to Marina back there.
So my name is Marina, I'm an occupational medicine physician, and I'm not sure if it's a comment or a question, I guess I'm just thinking aloud. I want to expand a little bit on that sort of, on the discussion about physical health program versus mental health program, and commonalities or differences, whether it can be one or two separate. And I think we can think of one program probably when we think more about sort of secondary, tertiary prevention. But when we really think about health promotion from a mental health point of view, I think it's way more complex than our approaches to physical health. Because physical health, you can really say, oh, occupational health, just come up with a program and implement it. We cannot have a program to address health promotion from a mental health point of view. That program is just one small component. How you diagnose early, how do you refer, how do you deal with disability, and so on. And I guess where I'm getting, I used to work at the hospital as a medical consultant, and we were tasked with coming up with a mental health program for physicians because physicians were unhappy. And we just sort of sat together and scratched our heads, well, where do we start? We'll create a website. We'll put a link where to go if you feel stressed. But it doesn't really work.
No.
So it's a little patch. So that's where you need leadership buy-in. So if the physical component can be addressed by occupational health by itself, when it's mental health, it starts with the leadership. So it's this organizational culture, is what you said in Maggie, I think Maggie is your DriverCheck. It has to be leadership buy-in, and it's not only buy-in, it has to be championed by the leadership of the organization. If physical health can be championed by occupational, maybe physician or occupational health department, mental health, or mental well-being rather, starts with the organizational culture, which is championed by the leaders. It has to be the CEO, all the the upper echelon in the organization. So it cannot be just occupational health. And that's where it's important for occupational health to work together with human resources, but even more importantly, the leaders of the organization. Otherwise, it's just not going to work.
Yeah, I agree. It's leadership, and leadership needs to be equipped. Why do we assume that they know what they're doing? Like, why do we assume that? Because they have the title? Because they have the position and the autonomy to make decisions? Why do we do that to them? It's not fair to any leader. We need to help them be equipped to lead. Yes?
Leaders take note. Going back down there.
Just to build on what you said, it can't be led by occupational health, it can't be led just by HR, it can't be led by EHS, it has to be everyone's thing. So that's the key. It has to become a common ownership, and you have to engage key stakeholders in all of those departments. But the thing is, you can't just rely on senior leadership, because as you said, they don't know what they're doing, they've got other things on their plate, so you need a person or a group of person to really set their mind into thinking about it and be peddlers, sell it to everyone. This is something really important, this is something we have to do, and engage it. And so before I got to get the approval person to work on it. It took me at least 3-4 years, but
Yeah.
I had a bunch of executives and most of the VPs that were enrolled on it. But still, now, like, it's part of the progress that we're making, but there's a long way ahead. Because when it comes to role modeling, well, some of them are, but a lot of them aren't. And connecting to pieces and, like, what does it mean when I do this, when I do that, when I answer emails right away, when I answer in the evening and work on the afternoon. So that's the whole thing. It has to be all of those things. That's why I was saying earlier, like, when you start building, you've got a lot.
Great points. We're hearing over and over again, it's got to be top down. It's got to be the leaders. It's got to come from the top to show people what they need to do to model the right behavior. So all great thoughts. I'm going to go down here for perhaps one last comment before we wrap things up with the panel.
Yeah, just one quick question, and this is for anybody out there that might be able to answer it. You had mentioned earlier about the CSA standard and things like that. There's a lot of expertise on the stage here. Do you guys see the overall wellness ideology, like physical well-being, mental well-being? Do you guys see that? I mean, I certainly see it as probably a contributing factor to workplace incidents and accidents. Or do you guys see this going the regulatory way, where the failure of a company to recognize this with all of the actual hard data around it, where government might help us out by stepping in and increase that, just like they did with duty to accommodate, just like they did pulling things out of CSA standards, even though they weren't regulatory, they have been used in case law to say the guideline to prevention was out there, and it was on the employer to go find it. Do you see this going the same way? I certainly hope so.
I just want to comment quickly. We talked about 35% of all countries doing something, right, internationally about health promotion and prevention. Why do governments only spend 2% of their health budgets on workplace health and wellness? Because they abdicate the responsibility onto the employer. And they like that, and they're hopeful, I feel, they're very hopeful that the workplace will mantle up, they will take that on. But it's not happening. And if you look at that policy statement by the World Health Organization and the International Labor Organization, that's a real big precursor. Like, I think you're on to something. So at the end of the day, I mean, the CSA standard is great. I've got lots of organizations that are using those 13 pillars and they're instituting them in their organizations, some really well, some struggling. But I think at the end of the day, I think there is a trajectory to this becoming more legislated if we can't get a handle on that. And then I think that takes away an opportunity for us in the workplace to build customized solutions. But at the end of the day, what option do we have if it's not going to be addressed? Good comment.
I hope that we will see this kind of regulated and made a little bit more mandatory. What I do picture is that if it does become that way in Canada, that there will be rules around, say, employers with 25 employees or greater have to implement a wellness program of some sort. And then it will be up to the employer, just dumped on them, to create a program. Will it be of good quality? Maybe, maybe not. And then I think you will see some employers become very competitive in like building out a very robust program in efforts to really shine as an employer. We're already seeing that, but I think that will continue in the future. But it would be interesting to see how the government would actually roll that out and who would actually have to participate in that, as far as the type of company, the type of work, the number of employees, things like that.
I have 2 cents, but go on.
I also hope that eventually there is some regulation around that. But I do think even before we get to that, I think the natural consequence of not attending to employee wellness in itself is such a heavy consequence for organizations that I think organizations will sort of be forced to quickly transform because, like I can give you a rough idea that out of every 10 people that I see who are dealing with something like burnout or anxiety, maybe 2 of them will try to stick it out. And a lot of times what they'll do is they'll use something like medication or substance to just keep pushing, pushing. But eventually, all of those people say, okay, this is affecting me way too much. It's affecting my family life. I can't be with that company anymore, right? So they're going to leave. So I think that natural consequence, when it starts to affect retention, it's going to be something that organizations will end up having to inevitably deal with.
I agree with all of that. The one thing that I perhaps have a different opinion on is the regulation part. The standard has been out since 2013, so it's almost 10 years, and nothing's been regulated. And I don't think that governments are going to jump in to regulate this. That being said, the standard has been used in labor arbitrations as best practice, where there have been employees who've been subjected to workplace stress, bullying, harassment, that sort of thing. It has been used as best practice. So even if it's not regulated, it stands as a standard that we are, at one time or another, probably going to be held to. So better to get in front of that, to recognize all the benefits, start putting things together, recognizing it's a complicated process. Communication is really important. Get that communication out, not just once a year, not just twice a year, but make that cadence really frequent, so that you're actually pushing information out to employees. We're at time right now. There's a bunch of presents to be given out as well, so I don't want to sort of take time from that. But I do, so many questions, great answers from our panel. Please join me in thanking all of them for their contributions. So thank you very much.